Welcome to
back
the podcast.
to the podcast.
Welcome to the Visceral Voice Podcast. Welcome to the Visceral Voice Podcast. I'm your host, Christine Schneider. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, a movement specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everyone. Welcome back to the podcast. Today, I'm very excited because I'm talking with one of my very good friends, Marita Stryker. Marita is an assistant professor of music at St. Olaf College, where she is the director of musical theater, teaching voice and contemporary singing styles. She is a PAVA recognized vocalist and movement specialist. Her teaching brings together a passion for contemporary singing, accessible voice science, and the mind-body connection that keeps the artist balanced, aware, and receptive. She has held teaching positions at Shenandoah Conservatory, Oklahoma City University, and Senzoku, I'm going to butcher it, I'm so sorry, Senzoku Gakuen College of Music in Tokyo?
That's it.
Okay. Her favorite performance credits include the national tour of John Doyle's Sweeney Todd and Tokyo's 2019 duo language production of The Last 5 Years as Kathy, although she has done numerous other productions. Outside of her academic studio, she maintains a small virtual voice studio with working artists in New York City, Austin, LA, and Tokyo. Marita, thank you so much for joining me for this conversation, a very important conversation today. And I'm just so stoked to, first of all, just have some time to hang out with you and to have this chat. And I know that there are more and more people who are really having questions and experiencing and getting diagnosed with our topic for today. So thank you ahead of time for all of the work that you've done, the research that you've done, and the presenting that you are doing to help inform other voice teachers on what we're talking about today, which is POTS, so postural orthostatic tachycardia syndrome.
That's it. Yeah. Well, thank you for having me. I'm so excited to be here.
Yay. Okay, so before we begin, I'd love to just kind of tell the listeners who you are, tell them a little bit about your journey, and then what led you to do your dissertation at Shenandoah University for or on this topic of POTS.
Absolutely. I've been a collegiate voice teacher for about 10 years. But the last few years, I have noticed that my students are disclosing chronic conditions more often. And the most prevalent among them is something called POTS, and I had never heard of it before. So I went seeking answers. I consistently have had, I'd say like 2 to 4 students every year in the past few years that have POTS and its comorbidities such as EDS, Ehlers-Danlos syndrome, or hypermobility of some kind. And there's a huge list of comorbidities. So me, I have a chronic condition of my own. So I have a huge empathy for singers that have to kind of navigate things in a different way. So I went seeking answers, and there just wasn't a whole lot of research in a PAVA breakout room, I asked a group of speech language pathologists and voice teachers if anyone had heard of it, and a couple of them had, and one in particular, Joanne Bozeman, had recently had students, and so we started talking extensively about it. And formed a little research group to find out more about how these conditions affect singers and how voice teachers can best support them. So we put together a panel of specialists last fall, at the PAVA conference in Miami. And it included Joanne and I, one of her former students who has POTS and hypermobility, her mom, the student's mom, who is a nurse, to talk about the parent's perspective and that diagnosis journey, as well as a physical therapist, a speech language pathologist who specialize in hypermobility, and a neurologist who specializes in POTS. So we had this panel of experts that shared as much information as we could in the short time that we had. And one thing that we realized in our research is there have not, as far as we know, there have not been studies done on how POTS affects singers. So I decided, with that being my dissertation year, that that's what I wanted to explore. So I set out to do a mixed method study, exploratory mixed methods. I did an online survey and just put it everywhere to see how many people I could get. And used it as a screening tool for case studies. Ended up with 6 case studies just to hear about the details of their journey. There were 6 singers at different stages of their diagnostic journey, at different stages of their professional journey as a singer. And it was really eye-opening to that experience. And I have some suggestions for voice teachers and how to be more aware, flexible, and creative in their teaching of these students.
Awesome. Which you are delivering those messages at conferences and also today, which I'm so grateful for. But at conferences, so by the time this podcast is actually released in a couple of weeks, you will have already presented at the Voice Foundation in Philadelphia. But you do have some still coming up conferences. So one is at the NATS National Conference in Knoxville, and then MTEA London in July. Both of those are in July, the beginning of July, and then closer to the end of July, and the one in MTEA with application in a rehearsal setting, which is very cool. So teachers, if you are at any of those conferences, I highly recommend checking out and stepping into Marita's presentation on POTS. So I'd love to just begin oh no, go ahead.
And my research partner, Joanne Bozeman, will also be presenting at PBOC in the fall. I forgot to tell you that. So we are kind of dividing and conquering. We're presenting together at NATS, and then we've both got some other conferences that we're going to try and spread the word together.
That is so great. So great. I forgot that you had worked with Joanne Bozeman, so I'm going to see if you can connect us because I really want her to come on to talk about hormones and the voice.
Yes, she's brilliant.
Yeah. So I'd love to meet her. Okay, so for those who are completely unfamiliar with POTS, know nothing about it, have never heard of it. So I already mentioned the name postural orthostatic tachycardia syndrome, also known as POTS, which we will refer to it as POTS from now on, just because that's a mouthful. But for those who are unfamiliar, can you just give kind of a brief explanation? How might it affect someone's daily life and activities, including a bit about how it might impact their singing?
Yes, absolutely. So I wanted to give you the consensus definition, which is POTS is characterized by a sustained heart rate increment of equal or greater to 30 beats per minute within 10 minutes of standing or head up tilt in the absence of hypertension. And this can be greater than or equal to 120 beats per minute. So basically what that means is that when a person goes from supine to standing or any kind of great postural change, their heart rate spikes, and that can cause a number of symptoms and discomfort. The thing about POTS is those symptoms can often be relieved by going back to laying down. So one of the most common ways of diagnosing POTS, one of the most common autonomic testing, is the tilt table test. So basically you're put on a table and raised to about 70 degrees. And you'll see on the monitor that the heart rate will go up within the first like 30 seconds of being upright, and stay there until you go back down, but the blood pressure will remain about the same. So that's the basic definition, but there are a number of symptoms that come along with it. And a number of comorbidities. POTS is very rarely the only thing going on. So because of that, it makes it very difficult to diagnose. Every patient presents very, very differently, and it affects their lives very differently. So depending on which kind of doctor they go to and what they come, complaining about as far as symptoms, it could take a while to get that diagnosis of POTS.
Mm-hmm. Yeah, similar to a lot of the comorbidities, similar to EDS, where it can take, Eloise Stager a couple episodes ago mentioned that it could take 10 years for someone to get that diagnosis. So challenging. It's very challenging when you're in that limbo of, something's going on, but you don't have a diagnosis, so you're not entirely sure how to approach treatment. So, okay. So what would be some specific challenges that POTS presents for voice students? What are things that voice teachers kind of might see in these voice students?
Well, a lot of the participants in my study complained of, well, dizziness was the top sort of complaint. And that happens typically with sustained notes or high notes. Brain fog is another common symptom. So feeling a little like you can't quite understand what someone is saying to you, a little spaced out, or you're having trouble with memory, which as you go into a conservatory type setting or any kind of college music program, and you're required to learn like 4 to 8 songs per semester and perform them memorized in your jury and studio classes.
On
So,
top of the musicals and the operas or
right.
plays or whatever else you might be doing. And in our case, on top of all of the instrumental music that we're playing.
Yes. So it can be, dizziness, it can be brain fog, it can be excessive sweating, shortness of breath, not just feeling like you can't stand for long periods of time. So our expectations around singing, especially in this, bias towards Western classical music sort of tradition that we have in most music schools, those are expectations. You're supposed to be standing. I mean, how many times have you been in, high school choir or even a rehearsal and like, okay, everyone stand up, let's do it for real this time, So there's this standing is not always possible for people that are experiencing the symptoms of POTS. But also the shortness of breath, the heart palpitations, sometimes chest pain, just weakness and extreme tiredness, very quickly fatiguing. A lot of similar symptoms to some of the comorbidities, such as EDS and hypermobility. So you can imagine when put in combination with whatever comorbidities each singer has, it can be a soup of different things each time. But specific for singers, standing for long periods is difficult. So being sure that there is a way to sit down or take a break or lay down in some cases, vary what's happening, being sure that you are flexible with your goals for each day, knowing that the singer might be experiencing different things. Mm-hmm. And we'll get into that later, I'm sure, but just those are some of the most common things that came up with the participants of my study.
Yeah. Variability is key. Having variability and the tools in your toolbox to be able to provide some variability anywhere, whether that is within a voice studio or a movement practice or a massage studio or wherever you are, just in
Mhm.
life, variability is so important.
Well, and to add to that, the symptoms are one thing, and that's definitely difficult to navigate. But something that came out that was a little, I don't know why I didn't expect it, but a little less expected, was the stigma around having to take breaks or having to sit down
Mhm.
or vary what you're doing. There was a feeling of being left behind or missing out or not being able to live up to expectations. Those sorts of things were even more heartbreaking to me in hearing the singers' stories. So not just flexibility and creativity and all of that, but empathy for
Mhm.
what that singer is going through and going about it um, without any kind of disappointment,
Mhm.
right?
Mhm. Disappointment without judgment.
Mm-hmm.
Yeah. Sometimes I was speaking with a friend today who um, does grief rituals and speaks at trauma conferences, and just extraordinary. She's just extraordinary, and she'll be in the on the podcast later this summer. And uh, just the mention of um, it had to do with the judgment and voicing. Shoot, I lost my train of thought. Um, it'll come to me, but it was off of what you just said, the empathy and, oh, yes, and how sometimes we can have a plan. Like we always have a plan for when someone comes in the room, but also knowing that that plan will most likely pretty much always change on what is walking in the room that day. And so just knowing that it's okay to have a plan, but it's also okay to absolutely shift from that plan, and that, what we might be expecting in our organized thought throughout a semester might have an ebb and flow to it. But to help that voice that is in the room really be able to shine through in the ways that it is um, more than capable of, but also where it is in that moment and on that day, how incredible to be able to let that shine, which is going to happen way more than trying to follow a structured, organized pattern. It's like, okay, cool. And that's, I think, part of when you mentioned the creativity, like bringing in some creativity to it. That's that, ability to be able to kind of go off the path of what the plan was and be able to come in with some creative thought so that the voice can just really flow, be optimal, and have the person there feel like they are very capable.
Which that's not just for people that are dealing with chronic
Yeah, for
conditions, right?
sure.
Like
Yes, that's right.
if we're taught in that way, then we're able to be that way as a performer and have that flexibility to bring whatever voice we have each day, whatever it may be, and accept that and thrive within that, right?
Yeah.
So that's just especially important when you have these factors.
Yeah, absolutely. How do you tailor like vocal exercises and different techniques to accommodate some of the needs of students with POTS?
It is tricky. And I will say, for the past few years, I have worked with less than 10 people that have POTS, but I've, read a lot of people's stories over the last year, and talked to a handful of others. So there are students that I have that I know that they do have this diagnosis, but if they had not told me that,
You wouldn't
I
know.
would, yeah. And that I would say that's probably the case, most of the time. But having that awareness that when the student emails me and says, "Hey, I can't come to my lesson today," they're able to say, I'm having a flare day and I can't come to my lesson. Like, can we reschedule, or can we, and I'm able to be more flexible about that. So there's that aspect. But in the study, I did hear a lot of mention of SOVT exercises, semi-occluded vocal tract exercises. So basically things like lip trills and humming, and we've all heard about straw phonation at this point, right? Fricatives and nasal consonants. Those sorts of exercises in a quiet, calm, usually descending way can slow down heart rate. So a couple of people in my case study mentioned that they actually used those to come down from that like pre-flare sort of state. And using that as a regular practice, I don't know, there hasn't been a scientific study on it, but maybe it has been able to manage some symptoms when it comes to performance. But it was mentioned by another person, another one of the case studies, that there's certain SOVT exercises that cause their symptoms, that cause them to flare. So communication is the most important between teacher and student, and trusting that the student knows their body better than you do, right? Knows their voice better than you do. And just trusting that they know, like, it's not that they don't want to do an exercise because they can't. It's that it just in this moment is not helpful for them. So can you find another way of whatever the goal was with that exercise, finding a resonant space, finding, breath regulation? Can you have another exercise that meets those same goals without causing the flare? More than one case study singer, right? I don't want to refer to them as case studies. More than one singer talked about how they avoid maximum exhalation, which of course most of us do, but especially it can be triggering for them. So using these exercises in elongated or sustained, but without getting too close to where you're going to feel like you're unstable. So those were the main specific vocal exercises that were mentioned. It was also mentioned to build stability, build stamina, become more comfortable with discomfort. So it's not a great thing to say as a goal, but are you able to still perform on days when you are having a minor flare? And one of the things that I love that came out of this is two of my singers that I interviewed are professional performers. And so, and I mean, like up there, like big budget performers. And one has found great success in collaboration and productions by, talking to the director or choreographer about specific choreography or staging that puts them in lifts, or even having to get off the stage really quickly in one direction and having to cross a really, like, can we be flexible with this? So if it's not possible on a day, can we have an alternate plan? She talked about her dresser having salt tabs in her little apron, or being allowed to have a water bottle off stage when normally that's not allowed, having space to lay down if needed. So little accommodations like that can go a really long way, and those can be used in the voice studio as well. And then another professional singer has found great success being in a wheelchair. So the only way that it has been possible for them to maintain their performance career has been with the use of a mobility aid, and they have found great success with that. So
on and off stage, or they use a wheelchair off stage so that they can
on stage and off stage.
On stage and off stage, yeah. Okay.
Yeah. So one of the beautiful things that's come out of this is that if I ever do have a student that comes to me and, this is every student, not just students with chronic conditions, but they always list the things that they can't do, right? But if they come to me and say, like, this is all the stuff that these are my limits because of my condition, now we have stories that we can say, like, this is success with your condition. This is possible. We just have to find out how it's possible for you. So I know I went on a tangent, but
Oh, that was all very important to hear. I mean, how
yeah,
extraordinary that you can find, that artist knew themselves and their condition and their passion to continue performing well enough to say, okay, well, I can do this at a high level if I allow myself to sit and allow themselves to do that. I mean, wow, how remarkable that artist did and knew to do that.
yeah. And I think, seeing the span of experience with even just the 6 singers that I ended up interviewing, we have someone near the beginning of their diagnostic journey that is singing with a choir and right now doesn't feel comfortable auditioning for solos. And one of the reasons is because, well, they don't know how they'll feel that day. And being nervous might, cause more symptoms and that vicious cycle, right? But also the logistics of bringing a stool up to the front of the group to do a solo would feel embarrassing for her on top of, already feeling nervous. But if we hear more about ways that this has been successful and ways that people have collaborated or maybe it's just normal to have a couple stools there from the beginning so that you just travel to the stool. Like,
Yeah.
I
I don't think
think
I've been to a concert that I haven't seen someone sit, whether it's their, cabaret or whether, I mean, think back on all of our concerts where someone else brought up a stool and then the artist walks forward and sits down on the stool. It's lovely. It also is like refreshing for the audience to see a change.
yeah, absolutely. So, I think a lot of it is just like giving yourself permission, advocating for yourself, and then seeing yourself in others and seeing that things are being done. You're not the only person in the world that will have to go up with a stool, right? I mean, I teach at St. Olaf, which is famous for its choirs, and I am so happy when I see people sitting in stools now on this very uniform, beautiful choir, right? Because it means they're still able to do it. There's something as silly as being able to stand for that length of time that really has nothing to do with your ability to sing, right? So a couple of people are like, why do we have to stand to sing in the interview? I'm like, you're right. Why? So that's something as a teacher too, just having a stool, I have a giant like birth ball, what is it called, yoga ball. I never used a ball in yoga, so I don't know why we call it a yoga ball, but it's fine. It's a really big one so that my students and it's not just my students with POTS, can still be energetically sitting, but not be too, like, their pelvis isn't below their knees in a chair. But it's somewhere between a lean and a sit, and it's active. So there are numerous ways that you can allow for posture change in your studio and then teach good technique, whatever that means, good support of singing in seated postures as well.
Yeah, actually, in all of my voice lessons with Joan, for the most part, all that I remember, which was a lot. So all that I remember though, is that she did start me in seated, just because by the time I started studying with her, though I continued to have a performing career, certainly with her, um, by the time I got to her, I had such anxiety around my voice and studying it. So she would just start me there for my own anxiety, and just starting seated allowed me to, come into a more regulated state with my nervous system before standing up. So we always started seated, and it was so unbelievably helpful for me to start in a, seated position rather than a full standing position. So
Right.
you
And when
mentioned,
you think
oh,
of,
sorry.
oh, sorry. When you think about, what is POTS, if we were to look at it from an autonomic nervous system function place, it's an overactivation of the sympathetic nervous system, right? So singing is often going to stimulate the parasympathetic nervous system. So all the more reason to keep these singers singing. It might even help them regulate and manage some of their symptoms. So if we're able to find the ways to, just, I mean, it is possible. If we just allow it to be possible, then they could see a lot more success. For sure.
Yeah. You mentioned salt tabs and you mentioned having a bottle of water
Right.
off stage. So with hydration and nutrition, what kind of roles do those play in managing POTS symptoms?
Right. So one of the first things that you'll hear most folks in the medical field say to a singer or a patient that's come in with POTS is, oh, well, let's, up your hydration and drink some Gatorade and saltines. So almost every single person that filled out the survey talked about hydration, increased salt intake, increased electrolytes. But then, and yes, that is important, and it can help bring them out of a flare sometimes. So being prepared with those things is really important. But then I also had people who said, but that's not all I need, like there's not enough information out there, even to doctors, at this point, and not as much consensus on diagnostic criteria and treatment. That some doctors, that's all they know at this point is drink more water, eat more salt. And one of the singers I talked to is in a part of the country that doesn't have a specialist nearby, and the specialist that is the closest has a 2-year waiting period.
Wow.
So she still has to wait a year and a half. She had to turn in all this paperwork, all of her blood tests, like it was like an application process for college, basically, to get in to see the specialist. And she still has to wait another year and a half before she actually has her appointment. So right now she's working with her GP, her general practitioner, and who she loves and really trusts. But right now it's just salt and water and electrolytes. And it was really hard for me as, the the researcher, not to be like, this is all the things I heard from everyone else so far. But I did send resources at the end of my study to everybody who participated. Anything that I had collected from our research last year, from the specialists we talked to, or other suggestions that were made in the advocacy groups. Yeah, so salts, water, electrolytes are important, but they are not enough. And they come up quite a bit. But if that is all your doctor is telling you about, please continue to look for more information.
Yeah. I'd love to kind of bring in how, physical posture, body alignment, and certain breathing techniques, what might be beneficial and what breathing techniques might not. You already mentioned that, there were several artists that talked about how full exhalation kind of created symptoms. So I'd love to hear kind of what kind of positioning seems to be like good positioning for someone with POTS, as well as what breathing techniques might be more helpful and what might be something that we wouldn't do with these students.
Right. So something I wouldn't do are things that raise the heart rate. So really quick, energetic, sort of like build up your energy sort of breath work is probably not what I would do with a singer with POTS. I mean, unless they're feeling really good that day and feel like exploring some of those more like energetic agility exercises. And that's, again, why communication is so important. But knowing what exercises are going to bring down the heart rate, what is going to calm the system. And it's all the, yoga and breathwork, mindfulness, all that stuff that we learn about in self-care. Bringing awareness to the breath and starts to kind of slow us down. And so those sorts of exercises are going to be really useful. A little bit of resistance sometimes to start to build the stamina, but not with too much athleticism. I don't know if that's the word I'm looking for, but sometimes I use a Buteyko breathing belt. It's if you've ever had a baby and used one of those elastic belts that goes around after, like postpartum, it's basically the same thing. I bought the Buteyko breathing belt and I was like, I already had this. But it's great to have in the studio because you can, it's variable. So it can fit around multiple people in different ways, and there's a lot of adjustment you can do to it. For someone with POTS, I might just put it around just to bring the awareness to the torso, not on a tight sort of stabilizing way that I might with someone with hypermobility. But things like that just kind of bring the attention to the lower part of the torso, that instead of being up in the top of the chest. I've also used a backpack. I mean, I teach college students, so they all have backpacks, and just put it on their front so that they have kind of a stabilization on the shoulders. They have the straps that go under the arms to connect to the backpack, so you feel the outer ribs. They have something giving them feedback against the front of the torso, and then they can put some energy into thinking posterior as well. So you have expansion in all directions, but you also just have that comfort of weight, which again, I think kind of starts to regulate the system. Yeah, so like any of the exercises that you know about that slow things down would be useful.
Yeah. Yeah, that reminded me of the weighted blanket, and then bands around. Yeah. So when you are in a vocal training session, how do you address pacing and rest for these students?
Well, just like any student, I check in at the beginning. How are you feeling today? How's your body? How's your breathing? Have you sung today? What's your voice acting like? That kind of thing. And have a pretty decent awareness of what they look like, what energy are they giving you. So if someone's experiencing brain fog, you can sometimes see it if you know that person, right? If someone is having shortness of breath, you can definitely tell. You can see some of these symptoms, and I never assume, but I will ask, like, hey, are you doing okay today? Do you want to sit on the ball today? Do you want to what do you feel like we can sing? But then I think, you get to know your students, and you can hear when things are working in a different way. And I just ask, I check in. And if we need to pivot, then we pivot. If I have a student who, and this happened this semester, that is preparing for a big role in a musical, do we pivot? Or do we talk about how to handle this situation if it comes up in rehearsal or if it comes up in performance? What are the things we can change and what are the things we can't? And when is the moment when we're like, maybe this is a day you have to sit out?
Yeah, important. I just thought of this, but do you know, are they on something like a beta blocker?
Beta blockers were mentioned by a couple of people, and one very enthusiastically said that it made a huge difference for them. It is not always recommended, but it just depends on your communication with your doctor. And I also want to mention that for singers or patients with POTS, it's important to have a team of people if possible. So it's one of those, what is it, the monks and the elephant situations where they all have their hand on a different part of the elephant and they're like, oh, this is a cheetah, this is a, like an anteater. Like they all see something different based on what they're touching, right? The doctors all see something based on the symptoms that pertain to what they're looking at. But if you're working with a team of people that can be in communication with each other, then you can get a more holistic treatment plan that is often more successful. And that also sometimes includes a therapist. The anxiety and depression are also comorbidities. So being sure that you have a support network that's more than just one person, being sure that if you can, talking to your family and being sure they're educated, or your peers and teachers. And diagnosis can be really tricky, or sorry, disclosure can be very tricky. There are students that didn't feel comfortable disclosing their condition because they were in a very, like, they called it a classical, just get to rehearsal and get it done sort of mindset. But then there were people who found amazing collaboration opportunities and advocacy within their teachers and leaders in performance spaces. So again, I think that might be one of those situations where the former just doesn't know what's possible yet.
Mm-hmm.
And you won't know until you disclose. And sometimes that just takes time and comfort and feeling supported in other ways before you're able to do that. And I know that was the situation with me, or is with me as well.
Yeah, I know that that's true for so many of my clients, regardless of a diagnosis, what the diagnosis is, or even if someone doesn't have a diagnosis, they're just vocally fatigued, to disclose that there's someone who fatigues easy, perhaps, or that they, have a cyst, or that they have a sulcus, or that they have MTD, or that they have whatever it is that they've been diagnosed with. It's very hard to disclose that information. And I know one of the hardest ones across the board for my clients is disclosing it to your agent. So, and I've seen many of them not having anything to do with the agent's reaction or response, just fear once they've disclosed whatever their condition might be or diagnosis has been, that they're just terrified that their agent is going to let them go or not submit them anymore because they have, X, Y, or Z. So I know that that's very real. And, I see it just kind of across the board. And so much of what messages that I try to get out there is that you're not alone. I promise. I see this all the time in different people coming into my clinic. There are numerous people that are feeling the exact same as you. And so it's just a matter of, having your team, like Marita said, and allowing your team to advocate for you, which is what we're all here trying to do to make sure that you can have the career that you want.
And those conversations are so important for the future of the industry as well. Little things like, in equity, you have 5-minute or 10-minute breaks, right? So you could have a 5-minute break after 55, am I saying this right? 5 minutes after 55 minutes of rehearsal, or 10 minutes after 80 minutes of rehearsal. Well, for someone that needs that rest time, or someone that's using a mobility aid and needs the time to get to the facilities and back, 5 minutes might not be enough time. So if you have these conversations around what everyone's dealing with, and maybe even let the cast vote on what they would rather have, instead of making those decisions that, we always do the 5-minute break, it just makes for a better environment for everyone involved. Yeah, but the professionals that I talked to did discuss how their agents advocate for them to get certain accommodations, but even with that, once they're there, there's this fear of using those accommodations, right? And what that stigma, what if that would bring out some kind of stigma in the actual reality of it.
Right. Yeah, absolutely. I definitely understand that. Are there tools or resources that you would recommend for voice students who have POTS, kind of to help them manage their condition, or voice teachers who have, we're all seeing more of this diagnosis. So, whether you've seen it yet or not,
you might not know about it, but I'm pretty certain it's probably in your studio. It's certainly been in mine numerous times. So are there kind of resources that you recommend looking up, researching, looking into?
Yeah, there are some wonderful organizations. There's the Dysautonomia Support Network and Dysautonomia International. And one is kind of UK based, one is US based. The Cleveland Clinic and some of the other major clinics like Mayo here in the US have wonderful information on their websites. There is an organization called POTS UK. And then and I think this is on Dysautonomia International there, and we didn't talk about cardiac rehab, but that's been one of the most or more successful treatment protocols for POTS. There are a number of studies on exercise programs developed specifically for patients with POTS. One is called the Levine Protocol. So if you look that up, it's Levine. And I will say one of the singers that I talked to, at first, their insurance didn't cover it, so their doctor had them doing it on their own at home. And they had a little bit better result, but not great. And then a year later, their insurance covered it, and it was like night and day. Like they were like preaching it from the mountains that Levine Protocol is the way to go. There are definitely books to look at. There's these are all mixed up with my EDS and HST. The Driscoll theory, newly revised, the cause of POTS in Ehlers-Danlos syndrome. There's Breath by James Nestor, which is fantastic. The Body Keeps Score. Some of these books, even though they're not specifically about POTS, can be really useful. But then, there's all sorts of mind-body sort of apps and books and things that, again, can just help with that parasympathetic nervous stimulation to help regulate a state of flare.
Yeah.
On top of everything your doctor says. I'm not a doctor.
Yes, we should always kind of say our disclaimer up front. This is not medical advice. This is just for educational purposes only. So before we go, we just have a couple more minutes. I just want to ask if there are any additional advice or insights that you would like to share about training voice students with POTS.
Some of the wonderful things that came out of the study, I mean, some of it was hard to hear, right? Like when there is discrimination, and I just heard recently about a situation of discrimination where, the student had been advocated for to pursue performance and do a recital, and then someone on the recital committee was really rude about the accommodation for memory aid because we're used to people being memorized for a recital. So some of it's hard to read, but I just feel like, first of all, the college students that I talked to were just wise beyond their years because of what they've been through, and they know themselves in such a deeper way than I ever knew myself in college. The performers that I talked to, the way they talked about what's possible in collaboration and performance was so inspiring, and how it touched audiences in a different way, in unexpected ways. And I think that's where the industry could and should go. But also I thought it was really interesting that there were so many people in the study that perform contemporary music styles. And, a lot of voice science has had an influx of studies, and it's fantastic. But the majority of these studies have been done with classical singers, especially case studies. And I think a lot of that is because as a classical singer, you get your bachelor of music, your master of music, your DMA, and then you go teach. And you have to have a certain amount of scholarly research. And so you do research on classical singing.
On what you know.
But contemporary singers, we just do the thing, right? So to have more research, and hopefully we can look at this, like why people with chronic conditions might go towards contemporary styles, or maybe it's just a general trend towards contemporary styles. But that came out as well, that it seemed to be preferred. So there were just some unexpected things that came out of it that I'm excited to keep exploring. And my research is not done, just the dissertation is done. But we will continue looking at this, and more specifically, how to help singers do what they want to do, help them use their voice in the ways they want to use it, and understand better how this condition might affect them.
Mm-hmm. Thank you so much for all of the work that you're doing in this, Marita. And I know, you had to narrow in on POTS for your dissertation, but I know originally you really wanted to look at EDS, POTS, and hypermobility. So I know that somehow your path will really lead to exploring more research and all of these conditions, and we are very blessed and grateful for the work that you're doing to help provide information for the rest of us and how to better treat and work with and help and assist these amazing, beautiful artists. So thank you so much. Always so good to talk with you. I'm so grateful. Thank you.
Me too.
Thank you all for listening. If you enjoyed this podcast, tell your colleagues, students, and friends. Subscribe, rate, and please write a review. You can find us on Instagram or Facebook, and feel free to check out my website at www.thevisceralvoice.com for information on programs and upcoming events. I hope you join us next time for another wonderful conversation on The Visceral Voice.